Good afternoon, everybody. The chairman of the Presidential Task Force on COVID-19 response and secretary to the Governmental Federation, honorable ministers here present, permanent secretaries, national coordinator, director general, directors, ladies and gentlemen. The Nigeria Center for Disease Control has now carried out a total of 183,294 COVID-19 tests in Nigeria, 28,296 of them within the week since my last briefing. 32,558 persons in total have been confirmed positive. The high figures within the past week compared to the previous weeks suggest an increase in the pace of testing, but also in infection incidents. From reports of the activation of sample collection sites in the FCT, the laboratory throughput will increase, as will the number of positives, until the curve begins to flatten at a yet unknown time. This strategy of creating more sample collection sites will follow a protocol of training, equipment, designation of correct space, according to a protocol to be set up by NCDC, and will be replicated in other states of the Federation. Therefore, increasing bed space at state level will continue to be advocated, as will the recruitment and training of health personnel to man the treatment and observation centers. We all know about the addition of the community support centers proposed by the National Primary Healthcare Development Agency to increase the space required for observation, particularly, and for treatment of mild cases. However, the expected increase in positives would not be so dramatic if there were better and improved adherence by citizens to all advisories, and if we all determine to take ownership of and responsibility for reducing the spread of this disease. I emphasize again that conscientious wearing of masks is continuously being confirmed in various studies as the easiest, cheapest, and most reliable way to check the rate of spread. Some countries have made it mandatory by law and imposed a fine for non-compliance. Regular washing of hands, avoiding crowds, social distancing, and use of minimum of 65% alcohol-based sanitizers remain as relevant as at the beginning. 13,447 COVID-19 cases have so far been treated and successfully discharged in Nigeria, and we have regrettably recorded 740 fatalities on the whole. Our aim is to further reduce the fatalities by ensuring that those defined as vulnerable are protected with messaging of non-pharmaceutical measures and prioritized for admission to observation and treatment centers, even if they do not yet have symptoms, but so long as they are tested positive. On Saturday, Federal Ministry of Health joined others from the PTF at the Premier Medical Warehouse in Jabi, at the invitation of the Director General of the West African Health Organization, WAHO, the President of the ECOWAS Commission, and the German government to receive a donation of medical equipment and supplies to the government and people of Nigeria, courtesy of WAHO, the West African Health Organization, to support our effort in responding to the COVID-19 pandemic. The donations include ventilators, test kits, personal protective equipment, and face masks, all being critical items in our COVID-19 response strategy. I wish to here once again thank WAHO and the ECOWAS government and the German government for the kind donation and also for facilitating the delivery. The 17-man team of the Federal Ministry of Health that was deployed to Calabar to engage with the Cross River State government in setting up their COVID-19 response and aligning it with the national response strategy has returned to Abuja after a successful mission led by the Executive Director of the National Primary Healthcare Development Agency. The team comprised of staff of departments of family health, port health services, public health, food and drug services, National Primary Healthcare Development Agency, Nigeria Center for Disease Control, National Agency for Food and Drug Administration and Control, and representatives of the Standards Organization of Nigeria and the Nigeria Immigration Service. You will see that this is a very comprehensive list, and they had useful interaction with the Cross River State government and ministries, and were able to address all areas of concern and of interest to the federal government and also Cross River State government. As we all know, Cross River State government has been concerned about its border with Cameroon and also about its coastal area and the traffic that goes on in there, for which reason port health services and immigration were with the team. Standards Organization was also there to review products manufactured within the state for possible validation. The Federal Ministry of Health will encourage and prioritize patronage of locally made commodities which meet a minimum specification. With this successful constructive engagement, I am pleased to report that Cross River State is now aligned with the Federal Ministry of Health COVID-19 response and has started reporting on the national dashboard. We have activated the Gene Expert Machine at the University of Calabar Teaching Hospital to increase testing capacity in the state, and NCDC has resumed deployment of rapid response teams to provide technical assistance to their public health EOC to strengthen their incident management system. Following the intervention of this ministerial team with the Cross River State branch of the Nigerian Medical Association officials, issues that led to their withdrawal of medical services by doctors in the state were resolved, and the strike action has been called off. We plan to replicate the success in Cross River State with other states of the country where the need for policy alignment is found to be wanting. News of the development of an RNA extraction kit and its validation has been relayed to me from our research centers. I'm very proud of this development, which I have asked NCDC to evaluate because it will be a further step in reducing the dependence on imported commodities. I hope our researchers will continue with this trend and can be assured of the report of the Federal Ministry of Health. The National Institute for Pharmaceutical Research and Development has also applied for financial support to continue its research on the efficacy of Artemisia annua combination in the treatment of COVID-19, which I hope will resonate with research sponsors. NAFDAC recently also gave a report on a traditional herbal medicine that it looked into, which provide information on safety for use. But that report does not cover efficacy. The difference must be made very clear. The Disney Dome Treatment Center has joined the list of testing centers and will soon be open for treatment as soon as hospitality services are secured. The renovation of the Agura Hotel will begin very soon as an additional observation center for level 1 and selected level 2 cases. This will increase FCT capacity for bed spaces considerably. I thank you all for your attention.